What is hyperpronation? The straightforward answer, hyperpronation is excessive motion in the foot due to underdevelopment of the ankle bone or talus on the heel bone, calcaneus. However, the straightforward answer rarely explains the causes, symptoms, or solution. In order to understand hyperpronation, it's beneficial to identify some of its better-known pseudonyms like flat feet or fallen arches. The truth is, although few know the term hyperpronation, a significant amount of our population suffer from it, and most have no idea. That's because the effects don't always manifest in the foot. Instead, patients will suffer from knee pain, hip problems, lower back pain. The list goes on. When you walk, your foot is designed to disperse the weight of your body evenly. When hyperpronation occurs, the distribution of weight is disrupted. We have a naturally occurring space between our ankle and heel bone called the sinus tarsi. This space is what allows for even weight distribution when walking. In a hyperpronating foot, the space collapses, causing the foot and ankle to twist abnormally. This is called obliteration of the sinus tarsi. Walking is the second most common thing we do outside of breathing. During the course of a day, the average person takes around 15,000 steps. So the ankle and foot are abnormally moving 15,000 times a day. With every step taken, abnormal forces occur to the soft tissues of the foot, leading to abnormal motion up the kinetic chain. Hyperpronation is present at birth and will not resolve on its own. Therefore, the longer a patient goes without correcting it, the greater likelihood of problems presenting themselves. Thanks to the diligent efforts by those at Gramatica, a permanent solution has been achieved, one that requires minimally invasive surgery and allows the patient to walk almost immediately following the operation. The HyproCure solution involves a small stent that can be surgically inserted into the space between the talus and calcaneus, thus restoring normal motion when weight is applied and correcting weight distribution. The following videos will outline common problems associated with hyperpronation, testimonials from both patients and doctors, as well as a detailed look at the revolutionary HyproCure solution.